Good afternoon, Doc.
Hi, good afternoon.
Are you ready for our little tour for today?
Yes. I'm Karen Ann Bispo, and I'm a pulmonologist here at the Medical City Clark.
I've heard that the Medical City Clark has a new unit for TB diagnosis and treatment.
Yes, we do have the TB Dot Center here at the Medical City Clark.
Can you show it to us?
Yes, of course. Let's go. Yes, tuberculosis is still an issue in the Philippines because it's still endemic in our country. According to WHO, in 2019, the Philippines had the highest incidence of TB in Asia. Yes, most of them do have. Common symptoms of tuberculosis are cough of more than 2 weeks, fever, night sweats, anorexia, and loss of appetite. Yes, anyone can get the infection. Tuberculosis is spread via airborne, so meaning the TB bacteria can be suspended in the air for several hours and it can be inhaled by anyone. There are several risk factors for developing tuberculosis. One, of course, is if you have someone in your household who has tuberculosis, that's one. Number two, for patients with conditions with immunosuppression like HIV, those who are undergoing chemotherapy, diabetes, and dialysis are at risk for developing tuberculosis. Well, being a pulmonologist is, I think, very special because I'm able to help patients who have difficulty breathing. So it's like breathing for them. Well, it's a very noble profession. I'm helping the country to fight one of the biggest problem here in the Philippines, which is tuberculosis. So I'm happy that I'm able to contribute and to help the government in solving this problem. TB-DOT stands for Tuberculosis Directly Observed Therapy Short Course. Well, TB-DOTs would help in the screening, diagnosis, treatment, and treatment adherence of patients diagnosed with tuberculosis. Well, there are several tests to determine whether a patient is infected with tuberculosis. Here, we're doing Gene Expert initially, but there are other tests like sputum AFB and TB culture. Yes, these tests are safe even for those who are pregnant or who are trying to get pregnant. It will usually take 24 hours. Here we have Sir Dan, our TB Dots nurse.
Hi, I'm Dan, the TB Dots nurse here in Medical City Clark. Usually 1 to 2 patients per day because we're just starting. Common cases that we see are the active TB cases. The rare case is the multi-drug resistant TB patients. Because multi-drug resistant TB cases, these are patients that undergone TB treatment, but they were not able to complete it. That's why their body produces resistance to the TB drugs. Yes, because of the stigma. The common misconceptions as a Filipino, that it can be acquired through using utensils of patients with TB, because TB is airborne, not by droplet. Cannot be acquired by droplet. Okay, this is our reception area where we dispense the medicine. We have for children and for adult patients. Then, this is our waiting area where our patients is waiting for their consultation or taking medicine. Then, this is the consultation room where the doctor is doing her assessment with our TB patients. While on this area, this is the monitoring area where patients were lying down and monitoring is being done. But we have our sputum collection area, which is located outside the TB Dot Center.
Yes, tuberculosis is curable. After screening, establishing the diagnosis of tuberculosis in partnership with the Department of Health, we are providing free anti-TB medications for 6 months. Aside from this pharmacologic approach, we also provide support and education not just to our patients but also to their relatives. It is important to take the TB medications religiously. 1, to treat the active infection. 2, to avoid its spread. Typically, tuberculosis affects the lungs, and if left untreated, the active disease could result to a permanent lung damage. Aside from the lungs, other organs can also be affected with tuberculosis, like the brain, kidneys, and the bone. No, even those patients who had previous TB infections and treated could still get the infection. Well, we should encourage everyone to seek consult and to take their medications religiously. By just taking the medications and treating tuberculosis, that would be a very big help to stop the spread of tuberculosis. Aside from that, we should all practice how to cough properly or the proper cough etiquette, like covering your mouth when you sneeze or cough, and you use tissue instead of handkerchief when you sneeze, or just use your shoulder when coughing or sneezing to cover your mouth. If you're experiencing symptoms of tuberculosis like cough for more than 2 weeks, fever, night sweats, loss of appetite, and weight loss, do not hesitate to seek consult to your physician. Our center is always ready to help you and guide you during the treatment. We will also provide support and education to help you adhere with the medication. I'm Dr. Karen Bispo, pulmonologist,
I'm Dan Castillo, TB Dots nurse, your
your partner in health.